What's up, beautiful people? Another day, another study. Obesity is a chronic metabolic disease. It's associated with an increased risk of 13 cancers, including colorectal cancer, so colon and rectal cancer, post-menopausal breast cancer, which are two cancers. The mechanisms behind this association are thought to include insulin resistance, dysregulation of fatty acid metabolism, chronic inflammation, and other hormonal dysregulations and things such as adiponectin, resistin, leptin, those types of things. This was a retrospective study, so where they look back through charts, and a lot of times people will just poo-poo these types of studies, but they can be useful for determining what's actually happening in the real world. There are limitations to clinical trials, and oftentimes what we see is that when people aren't in clinical trials where things are routinely monitored and people know they're in a trial, that the results are different. And so these retrospective studies, they can't prove causality, but they can say what's happening in the real world. So this examined weight loss among 143,000 individuals, not through bariatric surgery, and the risk of cancer in a large integrated health system. And the risk of obesity-related cancers was lower in individuals who lost 5% of their body weight. Why 5%? Because that's usually the threshold that is used for clinically relevant weight loss, with reductions of 4.9% at 3 years and 5.4% at 5 years. For all cancer types, a 5% reduction in weight loss was associated with a 3.9%, 3%, and 4.4% lower odds of cancer at 3, 5, and 10 years, respectively. So, this aligns with the literature showing that obesity is a metabolic disease, that it is a disease in and of itself and is associated with other downstream disorders, including cancer. And so here we see that clinically relevant weight loss was associated with lower risk of cancer years down the line. Now, again, it's a retrospective analysis. It They didn't look at intentional versus non-intentional weight loss. There were some modeling issues, so assuming a linear relationship between weight change and risk. And the study didn't measure if weight loss was sustained over the entire follow-up period. However, it is something that I do encourage patients who are obese or overweight, who have other health conditions or have things that we think are related to the excess adiposity, to go over strategies to help with body recomposition